The leg is the region of the lower limb between the knee and the ankle. It's a tightly packed region consisting of muscles and neurovascular structures. The leg is organized into three fascial compartments: anterior, lateral, and posterior, which are formed by the interosseous membrane, the anterior intermuscular septum, and the posterior intermuscular septum. The anterior compartment of the leg is also known as the extensor or dorsiflexor compartment, and it's the area of the body you use to locate furniture after you turn off the lights. Ouch! It's bound anteriorly by the deep fascia of the leg and skin, posteriorly by the interosseous membrane, medially by the lateral surface of the tibia, and laterally by the anterior intermuscular septum and the medial surface of the fibula.
Enjoying our Osmosis videos? Unlock your full potential with an Osmosis subscription. Get unlimited access to every Osmosis feature and resource with a free 7-day trial.
Now, proximally, the deep fascia overlying the anterior compartment is dense, providing part of the proximal attachment of the muscle immediately deep to it, the tibialis anterior. Distally, the deep fascia presents two band-like thickenings organized as two retinacula. Retinacula help secure and provide leverage for the tendons of the anterior compartment muscles before and after they cross the ankle joint. Specifically, the retinacula prevent these tendons from bowstringing anteriorly during movement of the joint. First, there's the superior extensor retinaculum, which is a strong, broad band of deep fascia passing from the fibula to the tibia proximal to the malleoli. Second, there's the inferior extensor retinaculum, a Y-shaped band of deep fascia that attaches laterally to the anterosuperior surface of the calcaneus and medially to the medial malleolus and medial cuneiform. It forms a strong loop around the tendons of the fibularis tertius and the extensor digitorum longus muscles. The anterior compartment contains four muscles: the tibialis anterior, extensor digitorum longus, extensor hallucis longus, and fibularis tertius, which are all dorsiflexors of the ankle, raising the toes and depressing the heel. To remember dorsiflexion, think of the phrase fins to shins, with your toes being the fins you use to swim and you're bringing them up to your shins. The muscles in the anterior compartment are innervated by the deep fibular nerve, and blood is supplied via the anterior tibial artery. The tibialis anterior is the most medial and superficial dorsiflexor, and it lies against the lateral surface of the tibia. It originates on the lateral condyle in the superior half of the lateral surface of the tibia and the interosseous membrane. About halfway down the leg, its muscular fibers are replaced by the muscle's tendon, which continues its descent along the anterior surface of the tibia. It passes deep to the superior and inferior extensor retinacula and inserts to the medial and inferior surfaces of the medial cuneiform and the base of the first metatarsal. The tibialis anterior is the strongest dorsiflexor of the ankle, and it also helps produce inversion, or turning of the sole of the foot inwards. Second, the extensor digitorum longus is the most lateral of the anterior leg muscles. Its origin is at the lateral condyle of the tibia and the superior 3/4 of the medial surface of the fibula and interosseous membrane. The extensor digitorum longus forms four tendons superior to the ankle, which enter the dorsum of the foot along with the tendon of the closely associated fibularis tertius muscle. Once the tendons reach the phalanges, they divide into two lateral bands and one central band. The central band inserts into the base of the middle phalanx, and the lateral bands converge to insert into the base of the distal phalanx. The extensor digitorum longus extends the lateral 4 digits and dorsiflexes the ankle. Third, the extensor hallucis longus is a thin muscle that lies deeply between the tibialis anterior and extensor digitorum longus. Its origin is the middle part of the anterior surface of the fibula and interosseous membrane. The muscle courses distally along the crest of the dorsum of the foot to the great toe, and it inserts on the dorsal aspect of the base of the distal phalanx of the great toe. The muscle extends to the great toe and, unsurprisingly, also dorsiflexes the ankle. And finally, the fibularis tertius, which proximally originates on the inferior third of the anterior surface of the fibula and interosseous membrane and inserts on the dorsum of the fifth metatarsal. The fibularis tertius dorsiflexes the ankle, and it also participates in eversion of the ankle, or turning the sole of the foot outwards. Now, let's talk about the neurovascular structures in the anterior compartment of the leg. The main nerve of the anterior compartment is the deep fibular nerve. It's one of the two terminal branches of the common fibular nerve, arising between the fibularis longus muscle and the neck of the fibula. After its entry into the anterior compartment, the deep fibular nerve accompanies the anterior tibial artery, first between the tibialis anterior and extensor digitorum longus, and then between the tibialis anterior and extensor hallucis longus. It then exits the compartment at the distal end of the tibia and enters the dorsum of the foot. Now, along its way, it sends motor branches to the anterior muscles of the leg and dorsum of the foot. Finally, it provides sensory innervation to the skin of the first interdigital cleft, which is the skin between the first and the second toe, as well as to the joints it crosses via articular branches. Finally, the anterior compartment is mainly supplied by the anterior tibial artery, which is the smaller terminal branch of the popliteal artery. The anterior tibial artery begins at the inferior border of the popliteus muscle and immediately passes anteriorly through a gap in the superior part of the interosseous membrane, which it descends on its anterior surface between the tibialis anterior and extensor digitorum muscles. At the ankle joint, midway between the malleoli, the anterior tibial artery changes names, becoming the dorsalis pedis artery. Well, that was, shall I say, legendary? How about a quick break to see if you can recognize the main structures of the anterior compartment of the leg? Moving on to the lateral compartment of the leg, or the everter compartment, this space is bound medially by the lateral surface of the fibula, laterally by deep fascia of the leg, anteriorly by the anterior intermuscular septum, and posteriorly by the posterior intermuscular septum. From its superior limit at the level of the popliteal fossa, the lateral compartment ends inferiorly at the superior fibular retinaculum. The lateral compartment contains two fibularis muscles, longus and brevis. The fibularis longus, as its name suggests, is the longer and more superficial of the two fibularis muscles. It originates on the head and superior two-thirds of the lateral surface of the fibula. From this point, it travels distally behind the lateral malleolus and deep to the inferior fibular retinaculum. It eventually enters a groove on the antero-inferior aspect of the cuboid as it crosses the sole of the foot, running obliquely and distally to reach its insertion on the base of the first metatarsal and medial cuneiform bones. The fibularis brevis lies deep to the fibularis longus, and it's the shorter of the two. It originates on the inferior two-thirds of the lateral surface of the fibula, and its fibers converge to form a tendon which passes posterior to the lateral malleolus. It passes anteriorly and laterally to insert on the dorsal surface of the tuberosity of the fifth metatarsal. The fibularis brevis helps maintain the lateral longitudinal arch of the foot. Both fibularis muscles help with eversion and contribute to weak plantar flexion at the ankle. The superficial fibular nerve, which is the other terminal branch of the common fibular nerve, innervates the lateral compartment. It arises between the most proximal attachment of the fibularis longus and the neck of the fibula, from where it descends down the leg until it pierces the deep fascia at the distal third of the leg to become subcutaneous. Now, the superficial fibular nerve supplies motor innervation to the fibularis muscles and sensory innervation to the skin on the distal part of the anterior surface of the leg and nearly all of the dorsum of the foot. When it comes to arteries and veins, the lateral compartment does not have a major blood vessel coursing through it. Instead, perforating branches and accompanying veins supply blood to and drain blood from the lateral compartment. Proximally, perforating branches of the anterior tibial artery and their accompanying veins penetrate the anterior intermuscular septum. Distally, perforating branches of the fibular artery and accompanying veins penetrate the posterior intermuscular septum. Now that was a lot of info. Let's take a break now and try to recognize the components of the lateral compartment of the leg. And finally, we've reached the posterior compartment of the leg, or the plantar flexor compartment, which is the largest of the three. Now, the posterior compartment is divided into a superficial and a deep subcompartment by the transverse intermuscular septum. The superficial subcompartment is larger, and its borders are the transverse intermuscular septum anteriorly and the skin posteriorly, while the deep subcompartment is smaller and sits posterior to the tibia, fibula, and the interosseous membrane. Inferiorly, the deep subcompartment tapers and becomes smaller distally, and the distal transverse intermuscular septum fibers extend between the tip of the medial malleolus and the calcaneus as the flexor retinaculum. This retinaculum creates a compartment for the tendons and neurovascular structures of the posterior compartment to enter the foot behind the medial malleolus, which is often referred to as the tarsal tunnel. So the muscles of the superficial posterior compartment are collectively called the calf muscles, namely the gastrocnemius, soleus, and plantaris. Collectively, the gastrocnemius and soleus make up the three-headed triceps surae, while the plantaris is a small muscle with a short belly and a long tendon that may be absent in up to 10% of people. The superficial muscles form the characteristic calf shape of the posterior leg, and they all insert into the calcaneus of the foot via the calcaneal tendon. The gastrocnemius is the most superficial muscle in the posterior compartment and forms the proximal and most prominent part of the calf. It has a medial head, which originates from the popliteal surface of the femur superior to the medial femoral condyle, and a lateral head, which originates from the lateral aspect of the lateral femoral condyle. As the muscle descends, its fibers converge at the inferior margin of the popliteal fossa, for which they form the inferolateral border and infromedial border. Distally, the belly of the gastrocnemius combines with the soleus to form the calcaneal tendon, better known as the Achilles tendon, which inserts into the posterior surface of the calcaneus. The gastrocnemius is a major plantar flexor of the ankle, and since it also crosses the knee joint, it flexes the knee as well. Next, there's the soleus, which is deep to the gastrocnemius. It's a large muscle named with a proximal attachment in the shape of an inverted U. Specifically, it originates on the posterior aspect of the head of the fibula and posterior surface of the fibula, the soleal line of the tibia, and the tendinous arch extending between these two bony attachments. Fun fact, this tendinous arch of the soleus is where the popliteal artery and the tibial nerve exit the popliteal fossa. It's also where the popliteal artery bifurcates into its terminal branches, the anterior and posterior tibial arteries. So there's a lot going on there. When the knee is extended, the soleus acts with the gastrocnemius and causes plantar flexion of the ankle. When the knee is flexed, the gastrocnemius is not in tension, and the soleus causes plantar flexion all by itself. So long story short, if you want to work out your gastrocnemius muscles, do standing calf raises, and if you want to work out your soleus muscles underneath, do seated calf raises. And finally, the plantaris originates from the lateral supracondylar line of the femur and the oblique popliteal ligament, descends medially, and condenses into a tendon that runs down the leg between the gastrocnemius and soleus. And just like its two much larger brothers, its tendon blends with the calcaneal tendon. This mysterious muscle acts in tandem with the gastrocnemius, but due to its size, its function outside of proprioception is insignificant. And now for the four deep muscles of the posterior compartment, namely the popliteus, flexor digitorum longus, flexor hallucis longus, and tibialis posterior. First, the popliteus is a thin triangular muscle that forms the inferior part of the floor of the popliteal fossa. It originates on the lateral aspect of the lateral femoral condyle and the posterior horn of the lateral meniscus. From there, it runs infromedially towards the tibia and inserts on the posterior surface of the tibia above the soleal line. The popliteus unlocks the locked knee from a standing position to a flex position by rotating the femur laterally during initial stages of flexion of the knee. Next, flexor hallucis longus originates from the posterior surface of the inferior two-thirds of the fibula and inferior part of the interosseous membrane, descends inferiorly from the posterolateral to the posteromedial side of the leg, and passes posterior to the medial malleolus towards the sole of the foot. Ultimately, it inserts at the base of the distal phalanx of the great toe. The flexor hallucis longus muscle flexes all of the joints of the great toe in addition to weak plantar flexion of the ankle. Third, the flexor digitorum longus is smaller than the other flexors. It originates from the medial part of the posterior surface of the tibia inferior to the soleal line and descends the medial aspect of the posterior leg. It then passes diagonally posterior to the medial malleolus into the sole of the foot, crossing the tendon of the flexor hallucis longus superficially on its way. After it crosses the flexor hallucis longus tendon, the flexor digitorum longus divides into 4 tendons and inserts into the base of the distal phalanges of the lateral 4 digits. This muscle flexes the lateral 4 digits and helps with plantar flexion of the ankle. And finally, the tibialis posterior is the deepest muscle in the posterior compartment, and it lies between the 2 flexors in the same plane as the tibia and fibula. It originates from the interosseous membrane and the adjacent posterior surfaces of the tibia and fibula, and it descends down the leg between the 2 muscles until it passes posterior to the medial malleolus and reaches the calcaneus deep to the 2 flexor tendons. The tibialis posterior inserts into the tuberosity of the navicular bone, cuneiforms, cuboid, and sustentaculum tali of the calcaneus, along with the bases of the 2nd, 3rd, and 4th metatarsals. Its main job is to work with the tibialis anterior to produce inversion, and it also helps with plantar flexion of the ankle. Finally, it also supports or maintains the medial longitudinal arch of the foot during weight bearing. You've probably noticed a common theme to these 3 deep subcompartment muscles as they enter the foot, and that is that they pass posterior to the medial malleolus in what is called the tarsal tunnel. This is a great anatomical landmark to help distinguish the muscular tendons and neurovascular structures of the posterior compartment as they travel into the foot. From anterior to posterior, the structures can be identified using the mnemonic Tom, Dick, and Nervous Harry. The first and most anterior structure passing behind the medial malleolus is the tibialis posterior, then the flexor digitorum longus, followed by the posterior tibial artery, then the tibial nerve, and finally the flexor hallucis longus. Speaking of nerves, the tibial nerve is the most important as it innervates all the muscles in the posterior compartment. The tibial nerve is the larger of the 2 terminal branches of the sciatic nerve. It runs vertically through the popliteal fossa with the popliteal artery, passing between the heads of the gastrocnemius deep to the tendinous arch of the soleus. At the ankle, the nerve lies between the tendons of the flexor hallucis longus and flexor digitorum longus, and after traveling deep to the flexor retinaculum, the tibial nerve divides into the medial and lateral plantar nerves. Switching to arteries, the posterior tibial artery provides the blood supply to the posterior compartment of the leg and the foot. It's the larger and more direct terminal branch of the popliteal artery. It begins at the distal border of the popliteus as the popliteal artery passes deep to the tendinous arch of the soleus and simultaneously bifurcates into the anterior and posterior tibial arteries. The posterior tibial artery is accompanied by the tibial nerve and veins, and it runs posterior to the medial malleolus as described previously. Deep to the flexor retinaculum, the posterior tibial artery divides into medial and lateral plantar arteries, the arteries of the sole of the foot. Finally, there's the fibular artery, the largest and most important branch of the posterior tibial artery. It arises inferior to the distal border of the popliteus and the tendinous arch of the soleus, and it descends obliquely toward the fibula, running down the medial side of the fibula parallel to the posterior tibial artery within the deep compartment. The fibular artery gives rise to the nutrient artery of the fibula, the largest nutrient artery in the body. It also gives off numerous muscular branches to both the posterior compartment and lateral compartment of the leg. Distally, the fibular artery also contributes branches to the periarticular anastomosis of the ankle. Okay, fantastic job, you've made it till the end. Before we recap, let's see if you can remember the components of the posterior compartment of the leg. Alright, as a quick recap. The leg is organized into 3 fascial compartments. The anterior compartment is bound posteriorly by the interosseous membrane, medially by the tibia, and laterally by the fibula and anterior intermuscular septum. Anteriorly, it's bound by the deep fascia of the leg and skin. Inferiorly, the deep fascia forms the superior extensor retinaculum and the inferior extensor retinaculum. The anterior compartment contains the muscles tibialis anterior, the extensor digitorum longus, the extensor hallucis longus, and the fibularis tertius. The lateral compartment of the leg contains the muscles fibularis longus and fibularis brevis, which are responsible for eversion of the foot and plantar flexion at the ankle. The posterior compartment of the leg is divided into a superficial and deep subcompartment by the transverse intermuscular septum. The superficial muscles are the gastrocnemius, soleus, and plantaris. They all produce the action of plantar flexion at the ankle. These muscles also form the calf shape of the posterior leg, and they all insert into the calcaneus of the foot via the calcaneal or Achilles tendon. The deep muscles are represented by the popliteus, flexor digitorum longus, flexor hallucis longus, and tibialis posterior. To remember the structures of the posterior compartment passing posterior to the medial malleolus, we can use the mnemonic Tom, Dick, and Nervous Harry, representing from anterior to posterior the tibialis posterior, flexor digitorum longus, the posterior tibial artery, the tibial nerve, and the flexor hallucis longus.
Helping current and future clinicians focus, learn, retain, and thrive. Learn more